I think it's a little late in the afternoon, so everybody is tired. So I'm going to freshen you up by showing you some videos and reminding you of not so many years ago. So 2019. This was 2019, ladies and gentlemen, and suddenly the time changed. And during 2020, this is what happened. So I'm sure everybody remembers this because this was the cover story of major publication. But you all must be wondering that why am I talking about COVID-19? I think the topic that was assigned to me was something else. But COVID-19 reminds us of pandemics. This was the pandemic of 21st century. But we had a pandemic in 20th century also. Many of us were not born, but we should all learn from our history. And if we don't learn, these pandemics are going to come one after another. We were lucky to be born in an era where we had antibiotics and vaccines, which could end the pandemic. But there was a pandemic in the history which was a warning for all of us. The viral rage of Spanish flu in 1918 and 1919, which killed more than 50 million people, and for an estimate, it is said about 100 million people, which was more than the people who were killed in the World War I, which was going on at the same time. This reminds us of, ladies and gentlemen, that anything which kills over 10 million people in the next few decades, it's likely to be a highly infectious virus rather than a war. World War I, II, or III, that doesn't matter. What matters is our health, and that is at risk because of the microbes. So I'm going to talk to you today about one of those pandemics that were part of history, but that doesn't mean that they've gone. They can hit us again. And they've been hitting in different parts of the world at different times. I'm talking about influenza. And when we talk about influenza, everybody thinks it's a respiratory illness. But what I'm going to tell you today, that it is a respiratory illness, but it is more than just a respiratory illness. It causes significant morbidity, mortality, and social disruption. It has a big economic burden on the health sector. It is a health security threat. And since 2009, influenza A and influenza B, these viruses have been circulating in the human race. And the global attacks rates are estimated to be 5 to 10% in adults and 20 to 30% in the pediatric population. With about 3 to 5 million cases of severe illness and 500,000 deaths per year, we still have influenza within our community. 10 to 20% attack rates, and in some population, up to 50%, which is the pediatric population. Pandemics occur infrequently, but we've had a pandemic in the past where about 1/3 of the world's population was affected. And now it's time to learn from our history. So influenza is a public health challenge, and the associated mortality tells us and reminds us that this is time to do something about it. A public health burden not only in some parts of the world, but in the whole of the globe. So if we look at the number of specimens positive for influenza by subtype globally, we come to know that there are different subtypes of influenza, but influenza A and influenza B are the major ones. And similar is the case in our part of the world, which is the Southeast Asia, where you see mostly influenza A and influenza B viruses. I'm quoting some of the studies from Pakistan for relevance, in which we have seen that severe acute respiratory illness or influenza-like illness has been reported countrywide. And this was a study which was done in 5 centers and sites, and influenza virus was detected in 24% of the samples. Out of these 24%, 72% were type A and 28% were type T. Similarly, in multiple studies from different parts of the country, like this is from Sindh, infants less than 2 years of age with different viral pathogens, influenza and para-influenza were a major contributor. Similarly, in a study right here in Islamabad showed us that 75% of cases of respiratory illnesses due to viral pathogens, they had a major contribution of influenza A and influenza B. And this is similarly another study which was again done in this very city, Islamabad, which shows that there is a considerable number of cases being reported. But somehow in our routine practice, we do not test for influenza because the testing facility is not readily available, and it is available in the private sector, and it is quite expensive. And ladies and gentlemen, let me tell you, influenza is just not a respiratory problem. It can cause shortness of breath and flu-like illness, but it can cause much more complicated diseases than it looks like. Like it can cause neurological diseases in the form of confusion, delirium, even GB syndrome and encephalopathy. In the respiratory system, it can exacerbate the already ongoing asthma or COPD, but it can also lead to severe viral pneumonias and death. In the kidneys, it causes rhabdomyolysis and acute kidney injury. In the heart, which is the major contributor of mortality, it leads to myocardial infarction and stroke, myocarditis, and venous thromboembolism. It can lead to impairment in our glycemic control, and there is increased metabolic problems associated with this, leading to diabetic ketoacidosis because of impaired blood glucose control. It can also lead to pressure ulcers and weight loss and deconditioning. So it causes an 8% increased risk of stroke, 8% increased risk of severe pneumonia, 10% increased risk of heart attack, 74% increased abnormal glycemic events, and 23% experience loss of independence. So, ladies and gentlemen, is it a respiratory illness? This is my question to you. It's not just a respiratory illness, a mild flu which will go away. It is a condition which leads to much more devastating effects in our body. And that is why it is very important to prevent this problem. The early ecological studies started to investigate the cause-specific mortality during the influenza epidemics. And influenza accounts for about 15 to 30% of excess expected cardiovascular mortality seen during the influenza epidemic, which was ongoing between 1918 and 1919, extending up to 1920. And compared to the other times or off seasons, it is still observed that cardiovascular mortality increases during an ongoing influenza epidemic. So respiratory infections actually trigger myocardial infarction and stroke in a time-dependent relationship. So they not only increase the risk of MI post-ARI, but also the risk of stroke contributing to the cardiovascular mortality. And that is why Benjamin Franklin said that an ounce of prevention is worth a pound of cure. So we have to decide whether we want to invest in prevention or consume our resources in a not very fruitful way by curing this severe disease or illness. So that is why globally there is an influenza strategy for 2019 and 2030 going on, which aims to prevent, control, and prepare us for influenza. The vision is to attainment of the highest possible influenza prevention, control, and preparedness to safeguard the health of population. Then the mission that all the WHO countries and partners, they all collaborate to optimize and align the global as well as the national capacities for prevention, rapid detection, and response to reduce the burden and impact of seasonal, zoonotic, and pandemic influenza, with the goal to prevent and reduce the burden of seasonal influenza, control and minimize the risk of zoonotic influenza, and prepare, that is, to mitigate the impact of pandemic, which, God forbid, can hit us anytime. And for this reason, the overview of the Global Influenza Strategy 2019 and 2030 emphasizes on promoting the research and innovation to address the unmet public health needs for improved and novel diagnostics, vaccines, and treatments against this virus. Operational research for influenza prevention, control, and program delivery, and to understand the virus characteristics and host that derive the impact of influenza. We need to strengthen the global influenza surveillance, monitoring, and data utilization by having an enhanced, integrated, and expanded virological and disease surveillance. We should build a strong evidence base for understanding the impact and burden of influenza, and this has to be generated by doing a local research and data collection, and develop an effective influenza communication strategies across multiple sectors and stakeholders to provide advocacy for prevention, and from prevention I mean vaccination of our individuals. So in order to do that, we have to expand the seasonal influenza prevention and control policies and programs, especially to protect the vulnerable population, and integrate the non-pharmacological interventions into prevention and control programs. We are all now focusing on NPIs and prevention and preventive health in communicable as well as non-communicable diseases. So we need to design and implement evidence-based immunization policies and programs to reduce transmission of this disease, and design and implement evidence-based treatment policies and programs to reduce the morbidity and mortality, which goes very well with our theme of the conference of evidence-based medicine, which should be patient-centric as well. So strengthening the pandemic preparedness in response for influenza will make the world a safer place. And for this reason, we need to strengthen national, regional, and global planning to enable timely and effective pandemic readiness. And I'm very glad that we are joined here together today by Professor Tonma Pin. She is a strong advocate of influenza in Malaysia and globally as well, and a respiratory physician, Professor John Kolbe, who's President, International Society of Internal Medicine, who will propagate this message on all scientific forums that we all must need to contribute to overcome these problems. World Health Organization has categorized some high-risk groups in our population who should be specially protected from influenza. And these include pregnant females at any stage of pregnancy, children between 6 months to 5 years of age, especially the elderly individuals aged more than 65 years, individuals with comorbid conditions like diabetes, hypertension, ischemic heart disease, stroke, or any other immunocompromised state, and our healthcare workers, all of us. We need to be protected if we want to serve our country better. And the impact of influenza, especially on maternal, adult, and elderly population in Pakistan, needs to be emphasized. Because there's increased risk during pregnancy, increased risk of pneumonia leads to 2 lives, both of the mother and the fetus. It has impact on our hospitalization and economic, and a compromised immune system. If hospitalized patients get them, it gets very difficult to treat them. Elderly population also has a lot of comorbidities. They have high mortality rates. Their healthcare utilization is more, and the quality of life can be compromised. So more and more emphasis should be done on this set of population. So talking about influenza vaccination, there are different types of vaccination available: inactivated influenza vaccine, recombinant influenza vaccine, live attenuated vaccine, adjuvant influenza vaccine, high-dose influenza vaccine. But in our part of the world, we have quadrivalent influenza vaccine. Just to add to the information of everyone, we all know that these vaccines are produced every year, depending upon the circulating strain at that region, and they are produced every year. So for the time being, we have a quadrivalent influenza vaccine. The CDC, its guidelines and recommendations say that everyone 6 months and older should be getting a flu shot. And this is obviously CDC recommends for USA, but there are humans in every part of the world, and everyone, is at risk. But there are some vulnerable groups, as I told you, very small children, pregnant females, elderly, immunocompromised, and healthcare workers. At least they should be prioritized by the government policymakers and the healthcare professionals in societies to advocate for prevention and vaccination campaign for all of them. So for most people, we need 1 dose of influenza vaccine, and it is usually given in the September and October. But in some smaller children, we need to give 2 doses of vaccine. So the first vaccine and the second vaccine is given 4 weeks apart. Ideally, everyone should be vaccinated, but especially children 6 months to 5 years of age who are more vulnerable, pregnant females, healthcare professionals, people with chronic medical conditions, and elderly more than 65 years of age. In US and UK, it's part of the adult immunization program in the elderly population. But unfortunately, in a country like Pakistan, where we have a poor infrastructure of health, we are struggling to get a flu shot even by paying a price in the market. So elderly population, we all want to see our elderly population dancing and singing and being happy. But unfortunately, this is the vulnerable group. 65 years and older are at high risk of developing serious complications from influenza compared to the young and healthy. So therefore, they need more emphasis on detecting influenza, prevention, and early treatment if they get it. And the fever may not be a very prominent feature in elderly population, and the complaints may instead be exacerbation of any underlying health condition like congestive cardiac failure or exacerbation of asthma or COPD. So we need to be vigilant in them. There are lots of studies which have been published that the disease burden of influenza is beyond the respiratory illness. And individuals with chronic medical conditions account for as many as 80% of the hospitalizations for influenza in adults and approximately 50% of them in the pediatric population. So there's a functional decline in the activities and daily living, and older adults, usually they are frail, and if influenza infection catches them, they have the highest deterioration in the ability to perform even the basic activities of the daily living. So there is a domino effect of influenza, and the influenza virus triggers various effects that can exacerbate the underlying chronic medical conditions, leading to an increased risk of hospitalization and death. So there are so many things that the virus can do. It can lead to not only respiratory complication and exacerbation of asthma, COPD, and pneumonia, but it can also lead to increased risk of myocardial infarction and stroke. It can lead to diabetic complications. It can lead to neurological complications and decline in the cognitive function of the individual. And especially in older population, in elderly people, a retrospective review of lab-confirmed influenza showed that 77.2% of death occurred in more than 65 years of age, and 3 times their odd of dying during admission compared to young adults if you are older than 65 years of age. So the percentage of influenza-related illnesses, medical visits, hospitalization, and deaths of age groups between 2019 and 2020 were studied by some of the scientists, and that this study was done in US, and the hospitalization and deaths to influenza are the highest among older adults of more than 65 years of age. There are multiple studies which show that our older population is at greater risk of hospitalization and death. This is a study courtesy of my friend, Professor Ton Ma Pin from Malaysia, in which there was a retrospective study of 3,935 patients with upper respiratory tract infection, and 11.9% of them tested positive for influenza. And fever occurred less commonly among cases who were more than 65 years of age, and the risk of hospitalization or death in individuals in more than 65 years age was significantly greater compared to the individuals who were young and less than 25 years of age, as you can see in this picture. So age is an established factor, and you should be very careful in seeing the elderly population if they come across symptoms of flu and upper respiratory tract infection to check for influenza. So apart from the elderly population, maternal and adult population, especially adults with underlying health conditions and healthcare professionals. These are the two groups that need our special attention. In the maternal population, we know that there are physiological changes going on, and there's limited vaccines which are approved during pregnancy. And they can have adverse outcomes if they're not protected, because not one, but two lives are at our risk. So they should be advocating the use of vaccine in such populations. So the importance of vaccination as a preventive measure, I just wanted to emphasize over here that there is a myth that, vaccination is for pediatric population. But we all know that vaccines help in preventing the disease, protecting the vulnerable population, reduce the spread of the disease, they decrease the healthcare cost, they eradicate and control the disease pandemics, they prevent the complications and mortality, they make us learn and we become prepared for pandemics, they improve the quality of life, and they are overall important for global health security, because after all, we all live in a global village. So influenza vaccine in older adults has been seen to be very, very effective, and the meta-analysis have shown that it has shown 41% effective efficacy in all ages and 37% in more than 65 years of age. And reduction in admissions for influenza or pneumonia is also considerably high if we use these vaccines. So it is overall an efficacious vaccine. It should be given to the pregnant females to save both the mother and to pass on the advantages to the newborn fetus. And for adults with underlying health condition, we can not only reduce the disease incidence, but decrease the complications and reduce the disease transmission by the fact of herd immunity and reduce the hospitalization and healthcare cost. So just my take-home message that adults don't get vaccinated. This is something for children, for pediatrics. So vaccines are only for children, we often hear. I received vaccination full course during my childhood, so I don't need them now. Vaccines are not effective. There are so many anti-vaxxers. I'm seeing some faces from UK and US here where there's a strong anti-vaxxers campaign, and even in Pakistan. And I can get the disease anyway. Even if I get the shot, I get the disease. What's the point in taking a flu shot? Vaccines are not safe. I'm not very sure about the side effects, the serious problems it can cause. I'm not confident that I should be taking one. I'm healthy. My health is I'd never get a fever. I don't need a vaccine. My immunity is first class. Natural immunity is better than the vaccine-induced immunity. And then the problem of the low and the middle income countries. I can't afford vaccines, or vaccination is not covered by my state or my insurance. So the lack of awareness, limited health education and misinformation, accessibility, both geographical barriers and high healthcare costs, vaccine hesitancy because of the safety concerns, religious and cultural barriers, limited healthcare infrastructure and availability of vaccine. These all are the common barriers to vaccination in Pakistan. But we need more public awareness and education, improved access, healthcare providers training, reminders, systems, and incentives to increase the vaccination in adults, and partnerships and monitoring at a global level for our continued efforts to improve the health. So I will end here by saying, vaccines don't save life. You might be thinking that there is an error, and I wanted to write vaccines save lives. But ladies and gentlemen, vaccines don't save lives. Vaccination does. Get yourself vaccinated. Thank you very much for your attention.